annual talk, annual health talk. And this year's theme is Wellness Beyond Boundaries, Nurturing the Heart, Mouth, and Community. This year's theme is, an holistic topic. And I believe that as we are here this morning, our guest speakers, they are well prepared for us. I believe we understand. They are well prepared for us. And each of the speakers this morning, they are unique in their own field. So every topic they are going to speak on is well prepared for. And by the end of the day, after they are speaking, we will know that, yes, we have gained something, and we are definitely going to get something that is of value from each of them. So our first speaker this morning is Dr. A.O. Ajibare. He's a consultant, physician, and cardiologist with notable experience in the management of cardiovascular diseases. He's a very important person in his own field. Dr. A.O. Ajibare is a respected senior lecturer in the Department of Medicine at Lagos State University College of Medicine and a consultant and physician and cardiologist at Lasu, specialized in cardiology, hypertension, and internal medicine, known for clinical training and research in the field. Is an active researcher focusing on cardiovascular health with publications indexed on Google Scholar and Research Certificates. So, distinguished ladies and gentlemen, welcome with me Dr. A.O. Ajibare to the podium. Thank you very much, sir.
You're welcome,
You're welcome, sir. Thank you so much.
Our second guest is Dr. Oyakero Afolabi. Dr. Oyakero Afolabi is a dental public health specialist who obtained distinctions and credits at every level in his undergraduate, preclinical, and clinical training. He also obtained a Master of Public Health, MPH degree, and he is a fellow of the National Postgraduate Medical College of Nigeria. He has had employment and collaboration experience with ministries of health, universities, teaching hospitals, federal government agencies, and with international bodies and establishments. He is presently a senior lecturer, honorary consultant in the Faculty of Dentistry at the Lagos State University and the Lagos State University Teaching Hospital. He has held positions in professional organizations and has won many distinctions, scholarship, and awards. He is presently the coordinator for the Dental Research Center, Lasucom. Please, let's welcome him with a round of applause. You're welcome, sir. Thank you, sir. So the next speaker, you don't know, how many of you are on TikTok? TikTok.
Nasu.
So you're not on TikTok? Ha! You're missing. Just search Doopsy the Gynae. Doopsy the Gynae. The first time I saw her on TikTok, and I've been following her since then. There are so many things to learn from her. I just don't go to TikTok to go and see other things. I learn, and I've known her from there. So when I saw her picture, I said, wow, this woman is here. Welcome her. So her name is Dr. Modupe Olatokunbo Adedeji. Dr. Modupe Olatokunbo Adedeji is a highly accomplished physician. Her forte is the area of obstetrics and gynecology. She is also a go-getter with incredible passion for the care of women's health from the womb to the tomb. Dr. Modupe is also the consultant in charge of obstetric and gynecology units at the Lagos State University Teaching Hospital, Ikeja, where she supervises and trains resident doctors and house officers in obstetric and gynecology. She is a member of the Society of Obstetricians and Gynecology of the Nigeria, SOGON, serving presently as the Assistant General Secretary, Lagos Sector. She is a fellow of the National Postgraduate Medical College of Obstetric and Gynecology, a member of the Medical Women Association of Nigeria, the Medical Guide and the Nigerian Medical Association, an advocate for women's health, Dr. Modupe Adedeji has had several write-ups published in newspapers on topics such as cesarean section and cancer. She is a public speaker who has featured on various television, radio, and online programs relating to women's health. She is a co-anchor on the
So while we are waiting for our last, okay, she's here already. But unfortunately, NEPA has performed their acts. We are used to it. Okay, so while we are waiting for the Primary Health Care Department. So, she's Dr. Olayinka Goodman is an associate professor of community health and primary health care. She obtained her MBBS degree from the University of Ilorin and an MSc in Sociology from the University of Lagos. She is a fellow of the National Postgraduate Medical College of Nigeria in the Faculty of Public Health and also a member of the West African College. So, she's also a fellow of the National Postgraduate Medical College of Nigeria in the Faculty of Public Health and a member of the West African College of Physicians. She has a special interest in social medicine and women's health. She has extensive field experience in public health, serving in managerial positions in a leading NGO, working on interventional programs in areas of women's health, malaria, HIV/AIDS, water sanitation, funded by USAID, UKID, Global Fund, proud to join the department. I've said that earlier, that she's currently the acting head of the department and has previously served as the postgraduate programs coordinator and the public health residency program coordinator of the department. So, my dear members of Nasu Lasucom, can you join me to welcome our distinguished speaker, Dr. O. Goodman. Thank you very much, ma. You're welcome, man. Where is our chairman?
He's not here.
Where is he? What's the next program? We are waiting for our chairman. Please help me to call him. So while we are waiting for our chairman, can the media members give us something to at least shake our bodies? While
But till I get diamonds on you, cause I need your body closer. I love the way you bend over.
Okay, dear members, let's rise on our feet, please. We want to do something. If the media are not ready to make us dance, we'll dance ourselves. Let's rise on our feet, please. Did now, kilo shele. We are active people now. Oh yeah, I want to do something. Orimi, oruku, abiba ono se ma ko. Orimi, ejika, oruku ese, orimi, ejika, oruku ese, orimi. I believe most of us went to primary school, public schools now. Pata pata, orimi, ejika, oruku ese, orimi, ejika. We are talking about health. We want to see those who are healthy among us today. If you are not healthy, well, we'll know what to do for you today. Knees and toes, shoulders, knees and toes, knees and toes. Okay, thank you very much. Thank you very much. Let's have our seats while we listen to our chairman's welcome address. Thank you very much.
Greatest Nasu. Let me start by saying, there is victory for us. There is victory for us in the struggle for our members. There is victory for us. Forward ever, backward never, in the struggle for our members. There to Africa. I welcome you all. This is the Executive Chairman's welcome address. Comrades, it is my great pleasure to warmly welcome you all to today's Health Talk. We sincerely appreciate your presence and commitment, which clearly show that your health and well-being remains a top priority. This program has been carefully planned to create awareness, promote preventive healthcare, and encourage healthy living among our members. We urge everyone to participate actively, ask questions freely, and take full advantage of health screening and expert discussions lined up for today. On behalf of our great union, Nasu Lasucom Executive, I thank you for making time to be here and for your continued support and dedication to our great union. Together, we will continue to build a healthier and stronger Nasu. Once again, you are all warmly welcome. Greatest Nasu. Oh, sorry. We may need to observe a minute silence for one of our members who left us a few weeks back, Mr. Ogudipe Olusegun. May God comfort those he left behind. Amen. Thank you.
Thank you very much. Yes, the next. Okay. Yes, like I said earlier, it is important to know that among our distinguished resource persons today, each of them brings expertise and valuable insights, and none of them is of lesser importance. So each presentation has been carefully selected to enrich our understanding of health from different but interconnected perspectives. So I want every one of us to be attentive to their presentation this morning. And if peradventure you have questions, kindly pen it down so that at the end of the presentation, you ask your questions, and I believe justice will be done to our questions. I want to believe when we saw this topic, we're like, how are they related? So this morning, we will know how they are all related. Somebody usually say that overall body. So we are going to learn about how the heart, the mouth, and the community where we live are interrelated with our health. So this morning, our first presenter, we are going to introduce our first presenter to you in the person of Dr. A.O. Ajibare. Welcome, sir.
Yes, welcome.
Thank you, sir.
Thank you very much. Firstly, I want to appreciate every member of this great union for always calling me to come for your AGM. I think this will be like my third. Yes. So automatically, I'm now a member of Lasu. Lasu Nasu. So many times we've been discussing hypertension, we've been discussing heart disease, we've been discussing a whole lot of things. But today, we now decided that most of the things that we'll talk about, there are usually matters arising. There are usual questions that will follow because there are so many myths and misconceptions when it comes to hypertension. So we have decided that what we need to do today is to really break it down. So let's talk about those myths. Let's even answer the questions before you even start asking them. And that's why we came about the title of today's presentation, which is hypertension, the realities, the myth, and the importance in contemporary Nigeria. Next slide, please. Or can I have something to change my slide myself, if it's possible? Okay. So I think the first thing we need to first talk about would be what exactly is hypertension. So when it comes to hypertension, literally speaking, elevated blood pressure. So, but the question is, how high does it have to be? Because all of us, we have blood pressure. It's when it's high. That's when we call it hypertension. So high blood pressure is hypertension. So the question is, how high does it have to go? So there are three parameters, or there are three ways, or there are three areas that we can check our blood pressure. So the first one is the one that we check in the hospital. So you come to the clinic, the doctor checks your blood pressure. The second one is the one that you yourself, you can even do at home in the comfort of your home. And the third one is the ambulatory blood pressure. That's the one that's, we'll put the machine on you, you do your daily activities, then we'll now find an average of your blood pressure over the 24-hour period. So what is the cutoff for each of these ones? So the one that you do in the hospital, if we check your blood pressure, and you remember that we have two parameters to blood pressure, the up and the down one, the systolic and the diastolic blood pressure. So if the systolic blood pressure, which is the up one, is greater than or equal to 140, and the down one, which is the diastolic, is greater than or equal to 90, and it's consistent, then you are hypertensive. So that's the one for the hospital, the office blood pressure check. Now, the one that you can check at home, because your house is not the hospital. I mean, when you come to the hospital, it's assumed that you'll be a little bit tense. I mean, you may be a little bit anxious and all that. So that means the value for the one you check at home will be slightly less than that value in the hospital. So if the value in the hospital is 140 over 90, then the one that you check at home, the cutoff is 135 over 85. So if your blood pressure is greater than 135 over 85 and it's persistent like that, then you are hypertensive. While the third one, which is the ambulatory blood pressure, that one has a specialized machine that will put on the arm of the patient. It's on the arm for 24 hours. It will measure every 1 hour at night and every 30 minutes during the day. So we now find an average. Because when you are sleeping, your blood pressure should be lower than when you are moving around, right? So by the time you now find an average of the blood pressure over the 24 hours period, if the average is more than 130 over 80, then the person is hypertensive. I hope we have those ones as background before we now start moving to clarification. Next slide, please. So this is just telling us the different grading of hypertension, but I think what you should take away from this is those cutoff values that I've talked about. Next slide. So the reality of hypertension on our healthcare system is as depicted in this photo. Because the healthcare system, you agree with me, is not optimal like we want it to be. Then we now have the burden of hypertension on it. It makes it a bit dicey situation. Next slide. So what are these realities? So the first thing I want to talk about is the prevalence of hypertension. So there are different prevalence, meaning that how many people in the population is hypertensive. So there are different values, there are different cutoffs, but averagely, about 3 to 4 out of 10 people are hypertensive. And that's why I'm happy that the executive of our great union has put modalities outside for us to check our blood pressure. And once we check it and it's elevated, we'll now be able to know what to do about it. So, and the problem about this thing is that most people are not aware about their blood pressure status. because hypertension is a silent killer. It doesn't give any symptoms. So people walk around as if nothing is happening. I remember there was one outreach that we did, and we went to Computer Village. And we saw one man. He was the one manning the gate and collecting money for people that are parking. We checked his blood pressure. His blood pressure was 220-something over 140. And when you told him about it, he said, nothing do me. When I told him that you need to rest, he said, who go collect the money for gates? So it can be as bad as that people are not even aware. And now the people that are even aware, how much access do they have to care? And those are some of the problems that we also need to fix. And that is why most people, because of cost of medications, limited health infrastructures, they visit, traditional people, use some of the things that we'll still talk about, and so on and so forth. And because of limited screening opportunities, and that's why I still want to congratulate our ESCO for giving us opportunity to screen. And I hope once we screen and we see high figures, because most of us, we have our figures with us, and based on the figures I talked about, if you see that the figures are above the values that I've quoted, then you have to look for the physician to see so that we can sort it out. Next slide. So, but the problem is not only in Nigeria, it's not only in Africa, although the burden of the problem is with us in Africa. Unfortunately, out of the close to 7 billion population in the world, more than 1 billion are hypertensive, and majority of these people are in sub-Saharan Africa. And Nigeria being the most populous black nation, we contribute a significant amount of number to this figure. And previously, hypertension used to be the 7th leading risk factor for disability-adjusted life years. But as at 2019, hypertension is still number 1. And the unfortunate thing is that it's preventable. This kind of deaths and lifestyle loss is very, very preventable. Next slide, please. This is telling us that among all these things, famine, malnutrition, sexually transmitted infection, HIV, hypertension. Please, next slide. Hypertension is still the leading cause of death worldwide. Even war, famine, Fulani herdsmen still did not contribute as much as what hypertension is contributing to death worldwide. Next slide. So we did a study, and next slide, please. So we assessed cardiovascular risk factors among urban male socialites. And unfortunately, we found out that as much as 61% of the people that we surveyed are hypertensive. And it's not only that, most of them are not even aware. And most of the people that are aware, they don't seek treatment. And that is why we are seeing a whole lot of sudden cardiac deaths, people raising money for renal transplants, people raising money for dialysis, because hypertension is still the leading cause of kidney damage everywhere in the world. Next slide. So what are these myths? What are these misconceptions that people say about hypertension? Some people will tell you that hypertension only affects the elderly or the rich. Some people will say, "Àìsàn olówó ni." But that's not true. Hypertension is no respecter of anybody. It doesn't respect whether you are poor or you are rich, whether you embezzle money or you don't, whether you are Fulani or you are Yoruba. It doesn't respect. By the time the risk factors like genetics, sedentary lifestyle, high intake of salts, lack of exercise, cigarette smoking, excessive alcohol intake, by the time all these things join together, and because of the stress that we undergo, you don't sleep well and all that, hypertension can, affect anybody. So next slide. Some people will tell you that hypertension is a spiritual attack. One you're funny, or yeni, or is a catapult, yes, or is a stepmother syndrome. Is somebody that does not like you, not fishing. But that's not true. We have seen that, yes, Those things I mentioned, stress, obesity, lack of exercise, and all those things. So by the time they come together and you are indiscriminately, taking a huge amount of salt, it can, lead to hypertension. And the unfortunate thing is that this denial is what usually make a whole lot of people to come down with complication by the time you are diagnosing them with hypertension. So next slide. So some people will tell you that, once I start taking my hypertension drugs, you can use them for the rest of your life. I mean, you must use it for the rest of your life. And that most of those drugs are harmful. They cause a whole lot of problems. Okay, most of the time, yes, you have to take your medications for the rest of your life. However, I usually have one story that I tell people every time they ask me that, will I need to take my medication for the rest of my life? And the story is the story of the young man that I met when I first came to Lagos. I was consulting in a private hospital. And the boy was 24 years. He's an high executive officer in one of the leading banks in Nigeria. So he came through his HMO and we saw him. His blood pressure was, I think, around 200 over 24-year-old, yes. So we had to control his blood pressure with like 5 medications. So he was taking those 5 medications, and after a while, I stopped going to that clinic. But he has my number. So many years after, so he called me and he said that, doctor, I'm very sick, and I'm in the hospital, I'm on admission. I felt, okay, fine. Of course, the normal judgmental me will feel that. When you stop taking your medications now, why wouldn't you have problems? But the guy said no, he's been taking his medications very religiously and all that. And in fact, the problem is that his blood pressure is now very low. And I'm now like, okay, so what changed? Apparently, what changed was that the guy finished from school. He has a very big uncle in NNPC. Then the uncle helped him to get his job in the bank by moving the accounts of NNPC into that bank. So they gave him a higher role. So when Buhari now came to power, Buhari now decided that, okay, all money should move into single treasury account. So when they wanted to move the money, the bank now told him, the reason why you are holding this post is because of that money. If this money moves, then you have to resign. So the guy now said, no, he's not resigning. But the problem is that if they sack him, they have to pay him a huge amount of money. But if he resigns, they don't have to pay him. So the guy refused to resign. The bank now transferred him from Lagos. So then he was staying in Magodo. He was working in Highland. So he wake up 4 a.m. He will go to Highland. He doesn't come back home until like maybe 11, 12. He sleeps around 3 hours every day. So the bank now transferred him out of Lagos to one village somewhere in Osun State. So when the guy got there, he started sleeping like a normal human being, not like Lagosians. He would get to work around 7, wake up 6:30, go back home like 7. So naturally, his blood pressure started coming down on his own, but he kept taking the medications. So one day, his blood pressure became very low, and he landed in the hospital. So the story I'm trying to say here is that many times it's our lifestyle that drive that blood pressure up. So it may come to a time when that lifestyle is removed that your blood pressure medication may have to be stopped. So this guy, what we did then was that we stopped his medications and all that. So when everything now settled, and the bank now felt that, this guy has grown this bank in the village to a high enviable height. So they wanted him back in Lagos. So the guy said, no, he's not coming. That he's not coming, that he's done with Lagos. So Lagos itself is a stressful lifestyle. Next slide. So the other one is that some people will say that herbal medicine, agbo, can cure hypertension. So the problem with that is that the active ingredients in that agbo we don't know. The dose of the agbo, most people don't know. Some people will say you drink 1 cup. Some people will say that no, eat the agbo on fire for 5 minutes. Some people will eat it for 20 minutes. So at the end of the day, there is inconsistencies in all these things. And at the end of the day, there will be some things inside the agbo that can even affect the kidney and now worsen your hypertension. So next slide. So another myth is that people say that if you don't feel symptoms, then your blood pressure is fine. I don't need to check. I think we've mentioned that. So hypertension is a silent killer. It doesn't give most symptoms, except you now start having complications. And that's why you see somebody that will go to play football and slump and die. Because a sick person will not go and play football. And that's why you see somebody that will go to an hotel room, book pepper soup, call his girlfriend to come and meet him, and while exercising on the bed, they would have a stroke and die. Because the guy did not know his blood pressure before he started the bed gymnastic. So, the next one is that people will say that it's only overweight people that have high blood pressure. Yes, being obese or overweight is a risk factor, but it's not a respecter of your size or your BMI. One of the things I will say is that if you are obese, try and exercise and lose weight. However, thin people can also have high blood pressure. I'm sure we all have our results in our hand, so we can relate to it when we look at our sizes. So, myth 7. Some people say that if you reduce your salt intake alone, or you take your medications alone, that you can control your blood pressure. But many times it's not true. We need the combination of lifestyle changes and medication to treat blood pressure. You cannot, be taking blood pressure medication and not adjust your lifestyle. And you cannot just be adjusting your lifestyle alone without taking your medication. So it's a combination of the two that help us to reduce our blood pressure. So another one is that digital sphygms or digital BP devices are not reliable for blood pressure check. Yes, some are not reliable, but a whole lot of them are reliable, and we are even moving away from using mercury column sphygm for checking blood pressure because of mercury toxicity. So what usually happens is that you can imagine all those sphygms that we used to use in those days, people will just throw it away. And unfortunately, by the time mercury breaks and it leaches into the soil, it causes a whole lot of environmental hazard. So yes, digital sphygms are reliable, and that's what most people are using these days. So next slide. Okay, so some of it is that some people will say that I'm too young to have blood pressure, so there's no need to check. I think we have answered that. It's not irrespective of age. Depending on what you go through, your blood pressure can go up at any age. Okay, so one question that I mostly get many times is that the doctor only wrote the medication for me for 1 week, or the doctor only wrote the medication for me for 1 month. So once I take it for 1 week or 1 month, blood pressure is low, so I don't need to take it anymore. So that's not true. So there's no doctor that's going to write a BP medication for you and write tab amlodipine for life. It's not going to happen. So he's going to put a time frame to that medication with an expectation that you have to come back for review so that he will know what to do to that blood pressure. So there's no doctor, there's no cardiologist that will look at your face and I'll say that, this man is fair, and his face is very fine. It's only 5 milligrams of amlodipine that will treat him. No. So what we'll do is that we'll start with a particular dose of medication and expect that you come back. So when you come back, we can now measure your blood pressure and see what the medication is doing, and we'll now decide either of 3 things. Number 1, that blood pressure is not controlled at all. We add more medications to it. Or this blood pressure is fine now, continue with what you are taking, because nobody changes a winning team except Super Eagles. Then the third one is that this blood pressure is now going too low, then I need to reduce the dose of this medication. So it's not that we give you medication for 1 month and expect, because blood pressure is a chronic illness, not like malaria that would, you treat for. So, and that one will now take us to the next one, which is that some people will say that once my blood pressure is normal, I can stop taking my medication. No. So the analogy I usually give is that if you are driving down a slope and you want to stop your car and you put your leg on the brake, of course the car will stop. The reason why that car stopped is because your leg is on that brake. The moment you take your leg off that brake, then that car will start gliding down. So that's the same thing with BP medications and blood pressure. So the reason why your blood pressure is normal is because of the BP medication that you are taking. So you continue taking your medication. And that will now lead me to another one. So some people will now say that, oh, okay, my blood pressure is getting too low. Why don't I stop my medication? And the answer to that one is that, what is low? People will know what high is. In the hospital, 140/90. So what exactly is low? So low is when your blood pressure is less than 90/60. And what we say is that for blood pressure,